The way you slept last night, almost. Cost you everything. You just don't realize it yet. Between midnight and 4 a.m. blood becomes thicker by nearly 26%. Clotting activity rises. Heart rate slows down. Blood circulation becomes sluggish. And the posture your body stayed in during those critical hours either protected your system or quietly created a dangerous trap inside your arteries that could still be ticking right now. I've seen older adults pass away in their sleep. Not extremely old people. 62, 66, 70. They went to bed completely normal. Then, at 3 a.m., cardiac arrest, sudden clot, pulmonary embolism, a stroke so severe they never woke up again. Families standing there asking, "How did this happen?" He was perfectly fine. She just had a medical checkup. I'll tell you how it happened. Sleep posture. Their body stayed flat on the back, or tightly curled on the right side, putting pressure on the vena cava, or face down with the neck twisted at an unnatural angle, restricting blood flow through the vertebral arteries to the brain for hours without movement. Blood started collecting. Platelets began sticking together. A clot formed silently inside a vessel no thicker than a pencil. Your cardiologist probably never asked how you sleep. Your neurologist likely never brought it up either, because sleep posture isn't something they can bill for. No prescription, no special test, no insurance coverage. So it gets overlooked, while millions of people continue sleeping in positions that may quietly increase their risk night after night. A 2023 study published in the European Heart Journal reported that certain sleeping positions lowered nighttime clot formation by 61% in adults over 60. 61%. No medicinas. No blood thinners. No compression socks. Just body positioning. In this video, we'll reveal 4 sleep positions that may help protect your heart, brain, and blood circulation during the most vulnerable hours of the night. Ranked from beneficial to potentially life-saving. And number 1, some heart specialists are now referring to it as one of the most protective overnight habits for circulation and cardiovascular health. All references are in the description. Where are you watching from? Drop your location below. I read every comment. Now let's begin with number 4. This position helps prevent blood from collecting in the vein, linked to many nighttime clots. Number 4. The right side heart support position. Here's something many heart specialists understand, but rarely explain clearly to patients. The side you sleep on can influence how your heart functions during the night. And for many adults over 60, sleeping on the right side may place less strain on the heart's rhythm and circulation. Your heart sits slightly toward the left side of your chest. When you sleep on your left side, nearby organs, especially the lungs and stomach, can place subtle pressure against it. Over several hours, that pressure may affect the heart's electrical activity, especially in people who already deal with irregular heartbeat patterns or mild arrhythmias. A 2020 study published in the Journal of the American Heart Association observed 402 patients with atrial fibrillation during sleep and reported that irregular heartbeat episodes occurred 29% more often while sleeping on the left side compared to the right. That's a major difference caused simply by changing sleeping direction. The right side heart support position means lying on your right side with your knees slightly bent and a pillow placed between your legs to maintain proper hip alignment. In this posture, the heart rests with less external pressure from surrounding organs. It can maintain a steadier rhythm, pump blood more efficiently, and reduce unnecessary strain throughout the night. Researchers at the University of Munich used echocardiography to compare both sleeping positions and found that right-side sleeping improved stroke volume, the amount of blood pumped with each heartbeat, by nearly 11% compared to left-side sleeping. Across a full night of sleep, that reduction in workload may significantly decrease how hard the heart needs to work to circulate blood throughout the body. To set up this position properly, pillow height matters more than most people realize. Your head pillow should support your neck, so your spine stays straight from head to lower back. If the pillow is too low, the neck bends downward and may place pressure on blood vessels. If it's too high, the neck tilts upward and creates unnecessary muscle tension. The pillow between your knees should also be firm enough to keep your hips aligned. This helps prevent spinal twisting, lower back discomfort, and poor circulation to the legs during the night. A 2022 report from the European Society of Cardiology found that adults who regularly slept on their right side experienced 18% fewer nighttime cardiac-related events over a 12-month period. Researchers noted the strongest benefit in adults over 65 who already had existing heart conditions. For better results, try placing a body pillow or rolled towel behind your back. This can help stop your body from rolling onto the left side or flat onto the back while sleeping. Most people need around 2 to 3 weeks before the body naturally adjusts to this sleeping posture. And what comes next is a sleep position connected to a hidden nighttime danger most people have never even heard about, but understanding it could make a serious difference for your health. Number 3, the prone breathing optimization position. You probably heard about prone positioning during the pandemic, when hospitals began placing patients face down to help improve oxygen levels. What many people still don't realize is that this same concept may also benefit healthy adults over 60, and the effect can extend far beyond just breathing support. The prone breathing optimization position is a modified form of stomach sleeping designed to improve nighttime oxygen flow while reducing stress on the cardiovascular system. Traditional stomach sleeping is usually discouraged because it can twist the neck and place pressure on the spine. But this adjusted version is intended to reduce those problems. In this position, you lie on your stomach with one arm stretched forward while the other rests bent beside your body. Your head turns toward the bent arm. A thin pillow is placed beneath the pelvis to support the lower back and prevent excessive spinal arching. The head pillow should remain very thin, or removed completely if comfortable. A 2021 study published in the American Journal of Respiratory and Critical Care Medicine evaluated 540 adults between the ages of 60 and 78 and monitored their overnight blood oxygen levels. The findings were significant. Participants sleeping in a modified prone position maintained an average oxygen saturation of 97.2%, compared with 94.8% for back sleepers and 95.6% for side sleepers. That small percentage difference may not sound dramatic, but clinically it can represent the difference between efficient oxygen delivery and blood that struggles to fully support vital organs overnight. When oxygen levels remain higher, the heart does not need to pump as aggressively to meet the body's demands. That can reduce cardiovascular strain during the 7 to 8 hours of sleep. Researchers at the Karolinska Institute in Sweden also reported that prone sleepers maintained resting heart rates, averaging 6 beats per minute lower than people sleeping flat on their backs. Over the course of a year, that could equal nearly 3 million fewer heartbeats, meaning millions fewer chances for cardiac stress or rhythm disturbances to occur. To adjust to this position safely, begin slowly. Practice during the daytime for 15 to 20 minutes while reading, relaxing, or using your phone. This helps your body adapt more naturally before trying it through the night. The pelvis pillow is extremely important. Without support beneath the hips, the lower back may overarch and create significant discomfort by morning. A pillow between 2 to 3 inches thick is usually recommended for support without excessive elevation. A 2023 study published in the journal Sleep also found that the modified prone position reduced snoring by 52% and lowered sleep apnea episodes by 31%, both of which are considered independent risk factors for stroke and heart disease. For better comfort and long-term consistency, many people alternate between this position and the right side heart support position during the night, spending portions of sleep in both postures. And now we move into the top 2 positions, the ones backed by the strongest scientific evidence for supporting circulation, oxygen delivery, and overnight cardiovascular protection. Number 2, the fetal recovery position with spinal alignment. The fetal position is one of the body's most natural sleeping postures. But most people, especially after 60, curl too tightly, which can restrict breathing and increase pressure on the body during sleep. The corrected fetal recovery position is much gentler. You sleep on your side with your knees bent at about a 45-degree angle, not pulled tightly to your chest. Your spine should stay naturally aligned, with a pillow between your knees and proper support under your head. A 2022 meta-analysis published in Circulation found that a properly aligned fetal position reduced nighttime stroke risk by 39% compared to sleeping flat on the back. Researchers believe this position improves blood flow and helps cerebrospinal fluid move more efficiently around the brain during sleep. Studies from Stony Brook University also showed that this position may help the brain clear waste products more effectively compared to back sleeping. The key is not curling too tightly. Keeping the body relaxed allows better breathing, reduces pressure on major arteries, and supports healthier circulation throughout the night. A 2023 study in the British Medical Journal also reported better heart rate variability in people using this sleep posture, an important sign of cardiovascular health and recovery. For best results, try switching sides during the night and keep your spine supported with the right pillow setup. And now we move to number 1. The sleep position many experts consider the most protective for overall heart and brain health after 60. Number 1, the left lateral lymphatic drainage position. This is the sleep position many experts now consider one of the most powerful for overnight recovery and long-term brain and heart health. While sleeping on the right side may support a steadier heart rhythm, the left side offers a completely different advantage. It helps the body's lymphatic drainage system work more efficiently during sleep. This system, often called the lymphatic system, is responsible for clearing toxins, metabolic waste, and harmful proteins from the brain while you sleep. A 2024 study published in Nature Neuroscience followed 780 adults between the ages of 60 and 82 and found that sleeping on the left side improved lymphatic clearance by 38% compared to sleeping on the back and 21% compared to sleeping on the right side. Researchers explained that this happens because the body's main lymphatic vessel, called the thoracic duct, drains near the left collarbone. When you sleep on your left side, gravity naturally helps this drainage process work more effectively, reducing inflammation and improving fluid movement throughout the body. Chronic inflammation is strongly linked to heart attacks, strokes, blood clots, and cognitive decline, which makes this position especially important for older adults. To prepare this position correctly, lie on your left side with your knees bent at about a 45-degree angle. Place a firm pillow between your knees to keep your hips aligned and use a supportive pillow under your head so your neck stays straight with your spine. One small detail many people miss is placing a rolled towel near the waist. This prevents the torso from sinking into the mattress and helps keep the spine properly aligned throughout the night. A 2023 study published in the Journal of Neuroscience also found that left-side sleepers cleared beta-amyloid proteins from the brain 28% faster than back sleepers. These proteins are commonly associated with stroke risk and cognitive decline. Researchers following participants over 18 months also reported better cognitive function scores in adults who consistently used the left lateral sleeping position. For maximum benefit, many sleep specialists now recommend spending the first half of the night on the left side to support brain cleansing and lymphatic drainage, then naturally shifting to the right side later in the night to support heart rhythm and circulation. And there you have it, 4 sleep positions supported by scientific research that may help protect your heart, brain, blood vessels, and overall recovery during sleep. You don't need expensive equipment, medications, or complicated treatments. Sometimes simply changing the way you position your body at night can make a meaningful difference in your long-term health. If this video helped you, make sure to subscribe and turn on notifications so you never miss another health video. Thank you so much for watching.